Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow, MD, and Dr. Thomas Grove, DO, from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Dr. Grove is a regenerative medicine specialist and an expert in ultrasound-guided injections with extensive experience as an athlete and strength and conditioning coach. Today's program could open up a new life without pain for you. To speak with Dr. Darrow and Dr. Grove, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Now, here's Dr. Darrow with his co-host, Dr. Thomas Grove.
Hey there, Dr. Marc Darrow here with my best friend and office mate, Dr. Thomas Grove. How are you doing today, Dr. Thomas Grove?
Hey, Doc, feeling good. Got to pump in, feeling good. Ready to talk about some musculoskeletal medicine, Doc.
You know, it's so amazing. If you ever see Dr. Grove, and I hope you get to come in to see him, this guy is gorgeous. He's he takes.
Doc, your vision's going. I'm telling you, you got to get some new glasses.
He really is an amazing person. He's probably one of the best platelet and stem cell injectors on the planet. He uses ultrasound to guide the needle, and he's a master of that. He knows his anatomy better than anyone I've ever met. He's been trained by the masters in this field. And people always want to come in and see me. And I go, you really should see Dr. Grove. And they go, but I want you. You've been doing it longer. But I never had the training that he had. I learned by intuition. I practiced on my own body. I've injected, as my listeners know and my patients know, I've injected both my knees and my elbows and my wrist and my shoulders. And back in the day, I had some broken ribs. I had one of my staff inject those. I've had other people do my neck and my back and every single vertebrae, believe it or not, and every rib, hundreds of injections. And it wasn't the most fun thing, but it helped heal all of my gymnastic injuries from when I was in high school and college. And I know Dr. Grove has had a bunch of injuries. He was linebacker for the Cornhuskers, a great football team. And it's not easy being an athlete. It's a lot of fun, but then we pay the price later. And we're very lucky to be in this line of work because we do something that heals people very naturally, and we use it on ourselves too. And the nice thing about it, it's so easy to do. We can be seeing patients, and when there's a break, we can go and get our blood drawn or whatever it is we're going to do, whatever type of regenerative medicine it is. And we can inject ourselves right then and then get back to work. It's not any kind of big deal. You don't need anybody to drive you to the office. You don't need anesthesia. The side effect profile is nearly nil. People get a little bit stiff afterwards sometimes, but it's really an easy procedure to do. We use small needles. I know a lot of people come to us and they say they've had regenerative medicine, stem cells, platelets with other doctors and it hurt like heck. And we're very conscious of using small needles in order to reduce any kind of trauma to the body. And we've done it ourselves, so we know what it feels like. So, Dr. Grove, tell us about your career prior to medical school, because it's really interesting, I think, for people to understand who you are.
Yeah, my journey to this is a pretty regular one, right? I saw that this stuff worked, and I was fascinated by it. I'm like, this is what I'm supposed to do with my life. So, I was a multi-sport athlete in high school. I was doing everything, man. It was football, basketball, baseball, wrestling, track. Very, very fortunate to have some athletic parents, some good genes that helped me along the way. And then I went into football for my college career. And then after that, I got into strength conditioning. So I was really fascinated by the human body. How do we optimize performance, right? Whether that's sleep, whether that's your mindset, whether that's healing musculoskeletal injuries, right? If you're an athlete, especially the higher end, you're talking about the professional levels, you're going to have injuries. That's just a part of the game, right? It's tough to stay in aggressive training all year round without having some aches and pains here or there. And I saw both sides of it, right? I had a lot of buddies that were surgeons, a lot of buddies who did non-operative sports medicine. And I wanted to have both of those sort of experiences, so I ended up traveling the world, ended up doing about 50 or 60 countries, living with professional athletes, doing all their training, their cooking. That gave me a lot of really interesting insight into how we can treat the human body, right? There's a lot of different ways to treat it. You got really conservative ways of treating the human body, right? Just let it rest. You've got super invasive, aggressive ways of treating the human body. That's like the big orthopedic surgeries that we do. And then throughout my entire training, I really wanted to get into that surgery perspective, right? So if I'm a surgeon, what sort of things am I looking for from a patient? What are the surgical outcomes, right? And not to get too distracted by the fun of what surgery is. We talk about it all the time, but surgery is a really fun field. It's extremely challenging. We've got so much respect for our surgeons, our colleagues that ended up doing the operative treatment. But I really fell in love with regenerative medicine. And then, when you start using it on yourself from your own injuries, you really buy into it, right? It's an extremely safe, very conservative way to treat the human body. And to me, it just makes sense. We take the healing cells of the body, right? We can put that in a little syringe, use a small needle, and now we have something called musculoskeletal ultrasound, where I can really guide that needle and be very specific where we deliver these cells on target, right? Give it a little bit of time and tissue heals. We'd much rather do that instead of having these surgical complications, right? These big, nasty surgeries. And again, using something like ultrasound can really be helpful for diagnosis. Doc, we were talking yesterday. I'm holding it up here for everyone to see, but there's a new article coming out in Rheumatology News looking at, the use of musculoskeletal ultrasound. So after a decade or so, American College of Rheumatology is now developing a new draft to use musculoskeletal ultrasound and not only diagnosing, but monitoring different types of arthritis that patients can get. So the article really goes into depth about how good ultrasound has got. Doc, you mentioned you did a lot of training yourself. I mean, I'm fortunate to be young enough where this technology recently has got really, really good. So it's definitely a tool we love to use.
Yeah, I mean, I spent years and years and years, all of my continuing education was with a cadaver and an ultrasound with some of the best trainers in the world. And it's just amazing what you can see with an ultrasound. You can diagnose, and very, very important, it's much more, you can see better with it than you can with an MRI or an X-ray. X-rays show bones pretty well. They don't show soft tissue well. MRIs get a good mixture of both, but they're static, meaning you're in a position where you're not moving. And with the ultrasound, we can actually hydrodissect. We can watch this. We can put solution into an area and watch a tear blow up. We can see all kinds of things that we just can't see on MRIs, which are, by the way, overly sensitive. They will show things that are not really there, which is a real problem, like ACL tears. All the time we get people coming, I've got an ACL tear, I had an MRI. And then the surgeon goes in, finds out it wasn't torn. With an ultrasound, you can actually watch things move around and get a very good perspective. We do like to get MRIs also as an adjunct because we don't want to miss anything. But the ultrasound is really the best way, I think, to diagnose. And especially if you're going to get an injection, make sure your doctor is using an ultrasound to guide the needle so he can see where it goes. We get people all the time that have had regenerative medicine. They said it failed. I said to the doctor, use an ultrasound. No. Well, that's a problem. There are areas of the body you don't need to use it, but many of them you do need to use it. And I know Dr. Grove, who I watch all the time, I think you use it on just about every single part of the body, don't you?
Yeah, I love it. And again, just the more that you scan too, the more information that you get. And just in terms of, tissue quality, and like you mentioned, a really important point with ultrasound is it's dynamic. So we can find a lot of things that you're just not going to find on x-rays, CTs, MRIs.
Sure, you can stress a joint, exactly. You can watch it open up. You can see what's really going on. So I'm going to get to a question here, Dr. Grove. I like to stump the stars, and you're the star here today. But first, I'm going to give out our phone number so people can call into the studio and talk to us live. We would love to talk to people. And so get a pencil and paper and write this down. If you're driving, pull off to the side of the road, get off your Bluetooth so we can hear you. And the phone number to the studio to talk to Dr. Thomas Grove and myself, Dr. Marc Darrow, is 866-870-5752. I'll repeat it if you missed it. It's 866-870-5752. And if you want to get a free phone consult with our staff, you can call the office right now or anytime. They're by the phones. And the phone number to the office is 800-300-9300. That's 800-300-9300. And if you want to watch videos of us doing procedures, I think that's a great idea for you. You can go to the website, which is www.jointrehab.com. That's JOINTREHAB.com, www.jointrehab.com. And we have a spot on every single page where you can email either Dr. Grove or myself, and we will get back to you the same day. We're very, very conscientious about communication. We give every single patient our cell phone number, and facetiously we say, call us at 3 in the morning. You're not going to bother us, because if we're asleep, we turn our phone off. But the point is, you can call us at 10 at night, and we'll probably pick up the phone and talk to you. And I love communication with patients. They're always shocked when they come back in. They say, why are you guys the kind of docs that are always ready to speak to us? Most doctors we can't even get a hold of. And we both think, and when Dr. Grove and I have a very similar consciousness about healing, which is part of the healing is the communication with the doctor. Mm-hmm. And knowing that if something's going to go on and you're concerned, you can always get a hold of us. We get calls all weekend, all night. We're just on it all the time, and we want you to be happy and healthy. And that's the thing about our practice. It's a healing type of a practice. There are a lot of doctors that, and this is a great story. When I was interviewing for medical school, the dean of admissions said, I just had a gentleman come in who was straight A's, and I'm not going to take him, but I'm going to take you. And I didn't have very good grades in college. And I said, you're kidding, you're going to take me with bad grades? He goes, yes, because you're a communicator. And I want people who can communicate with their patients. So he accepted me on the spot, which is, I think, something that, he was a very, very judicious person. And his class was people that had prior experience in life. He wanted people with life experience. I was a lawyer beforehand. He had a concert pianist. He had just about everything in that class because he wanted students who knew the world and knew people and could communicate. And I think that's so important in our practice. So, Dr. Grove, I'm going to give out a question here right now to you and see if you know what this stuff is all about. So it says, hi, I'm a 36-year-old female that has had neck pain since I was 14 due to being hit by a car as a pedestrian. I have had SI and lumbar pain for 12 years since giving birth to my daughter. In 2024, I was diagnosed with a Bertolotti syndrome, and you'll tell us what that means in a minute when I finish this. I was born fused on both sides with my L5 to my sacrum. I've had several herniated discs, including one on my L5. I've done everything from chiropractic, PT, stem wave, decompression, steroid injections, FRA, etc. I have seen several specialists, and usually surgery is the recommendation. I'm terrified of surgery, thank God she is, due to my age and the complication it will potentially bring me down the road. I'm also terrified that I'll end up in a wheelchair as my pain continues to get worse. I refuse to take pain pills. Thank you, that's smart. I try to maintain my pain with PT exercises, chiro massage, and exercise. I truly believe my SI joints are the cause of my pain due to being born fused. And Dr. Grove, you'll address that and see if that's really true, and have limited mobility in that area. I'm extremely interested in PRP and stem cell treatment to my SI joints. I'm extremely open to other non-surgical suggestions. Dr. Grove, take it. What do you think of all that?
Yes, I've actually seen quite a few of these, especially in training. I don't know if it was just the location I was in, but basically what this is Bertolotti syndrome is what we call a transitional vertebra, right? So if we get back to some basic anatomy, right, you've got the lower backbones called the lumbar vertebra. Right below that, you've got your sacrum, and then to either side, you got the ilium bones, right, those pelvic bones. And what can happen is you get something called the transverse process, which is a little bony outgrowth on the lumbar spine. And if it gets really big, we can call it, this syndrome. And if that syndrome actually gets big enough, it can actually fuse with either the sacrum or it'll fuse with the ilium to the side. We see actually a lot of these in people who have no symptoms whatsoever. So I'm very curious to see if this is actually the cause of somebody's pain. But because we give it a fancy name, right, it doesn't look completely normal on an x-ray, we want to do surgery on it, right, which is not necessarily the answer every single time. Doc, we were literally just talking about this yesterday, how the mentor that I was trained by always liked to quiz me on the anatomic variations, and this is a pretty common one that we'll see.
Sure.
But this is something that, again, it can cause no symptoms whatsoever. Sometimes it's on one side, sometimes it's on both sides. A case that comes to mind that I had with a patient is they were very similar to this. They were like ready to have a surgery. It was on their left side, but their pain was on the right side. And I really had to have a heart-to-heart with them, telling them, listen, this is not causing your pain. Do not jump into a surgery like this. Best case scenario, you come out the same, but worst case, you cause more damage from a surgery like that.
Yeah, and my 2 cents on this, the take-home point is very simple. I have never seen one of these in 27 years of practice that was the cause of the back pain, ever. So, folks, be careful. These diagnoses sound very, very, I don't know a good word, romantic, is stretching it. But it's like you get caught in these diagnoses, and they're typically not even the cause of the pain. So in that area in the low back, we usually find that the problems are 3 different things. One is where the iliolumbar ligaments attach to the pelvis from the L4-5 vertebrae. Ligaments are pieces of collagen that hold bones together. Tendons are similar in nature, but they hold muscled bone. And in the low back, what we find 99% of low back pain is the iliolumbar ligaments that are stretched out or irritable where they attach, and we call that an enthesopathy. The enthesis is where these structures attach to bone. And unfortunately, too many people get surgery to correct something that isn't even the issue. It could be a herniated disc. This person mentioned their question that they have herniated discs. I have herniated discs up and down my spine. I don't have any pain. So what's that all about? We have to be super, super careful not to operate on a diagnosis. We need to use our hands. And almost every surgical failure that's walked in the office, I've asked the person if the surgeon touched their body to examine them. He said, no, they showed me an MRI or an X-ray or CT scan and showed me where they had to operate. To me, and this is not putting surgeons down, that's their culture. To me, that's not good medicine. Good medicine is doing things naturally, doing a really good history and examination, touch the area, find out, and this is the key, where is the pain being generated from? It's not being generated from a picture in an MRI. It's being generated from the body. So we poke around with our fingers. Our fingers and our hands are our MRIs in a sense. We've got to find the spot. We've got to move the person around. And 99% of the time we find the diagnosis they come in is absolutely wrong. So this Bertolotti syndrome, which is the fused transitional vertebrae, to me has never been once the cause of someone's pain. The other couple areas down there that can be part of the enthesopathy or the pain generator is the thoracodorsal-lumbar fascia. Fascia is collagen coating that covers the muscles and attaches down on the pelvis down there. And then we can also have the quadratus lumborum muscle, which originates at the lower rib and then inserts on the pelvis. So we have all of these structures that are inserting in this area that is sort of the fulcrum of the body, our bending, stooping, pushing, pulling, all the sports we do, golf, weightlifting, squatting. All of these things irritate that area. And they're very easy to fix. We don't promise anybody anything. Everybody signs a consent form that says there's no guarantees. With the work we do, people come in and go, what should I do? We go, we're not here to tell you what to do. We're going to educate you, and then you make the decision. And if you do want surgery, God bless you, go for it. We'll be here, for you one way or another. Unfortunately, a lot of the people that don't listen to us about the outcomes of surgery do end up coming back with a failed surgery. And then we find out that stem cells or platelets heal them up, and they could have just done that to begin with. Another thing, Dr. Grove, we're seeing more and more surgeons who are spraying on stem cells or PRP, platelet-rich plasma, before they close a wound. Does that make any sense to you, instead of just doing it with a needle and not operating?
Yeah, that's the part that's very confusing. It's like you either believe in this stuff or you don't. You know, a very common comment that I'll get from patients saying, well, I talked to my surgeon about doing this. I just wanted to get their 2 cents on it. And they said, well, it doesn't work. There's no research behind it, which is just the furthest thing from the truth. There's so much research on this stuff. Again, in the article I just mentioned before from the Rheumatology News, it's like 30,000 studies in the last couple of years using musculoskeletal ultrasound. There's so much good research nowadays. It's just if you're not up on it, you're probably down on it. And so if you're like, well, listen, there's some articles in there, but let's just add it into the surgery we're already doing. Why not just inject that structure, heal it up, and not have to avoid any of these sort of big complications? It just doesn't make a whole lot of sense to me.
Well, at the end of every day when Dr. Grove and I get together to talk about the day, we are so confused about why doctors are doing what but it is moving very slowly into what works. And Dr. Grove and I are what we call empiricists. We do the things that work in medicine. My entire career in medicine has been trying to find things that work for people, not things that hurt people. So that's something that we're scratching our head about every day of the week, and it's unfortunate, but doctors are slow to change their habits. So be careful when you go to a doctor and you get an opinion. Go to another one, get another opinion, but don't go to the same class of doctors, because a lot of people come and they go, I've been to 3 orthopedic surgeons. They all say the same thing, I need to have surgery. Then the person comes in to see us, and literally we laugh after we do an examination. We go, you don't have a surgical condition at all.
Yeah, it's a question of, can we do the surgery versus should we do the surgery? And those are very different answers, right? I mean, there's lots of surgeries that we can do. You're probably not going to, die from the surgery, but there's always a chance, right? But there's just a risk for complications. Why are we doing these invasive procedures when we can just inject it instead?
And that's my point of view on all of medicine. I laugh with patients sometimes and they say, well, what should I do? And I say, the safest thing you do is don't go to a doctor. And they go, even you? And I go, even me. It doesn't matter. If you can heal something on your own, you can do it naturally. That's always the way to do it. And always save more invasive things for the end of your journey. So a lot of times people say, well, I had PRP or I had stem cells, it didn't work. And it doesn't work if you don't do it. How many times does it take? I don't know the answer. I've used it on myself many, many, many times. Most things I may heal overnight or within a couple of days. However, I've had some stubborn injuries that have taken months of treatment. So I'm just being honest about that. This is not a panacea. Stem cells and platelets, regenerative medicine is not a panacea of healing. It just makes sense. You're stimulating new tissue, regrowing an area, and rejuvenating it. But other failures in this field come from people taking anti-inflammatory medicine. We need good inflammation to heal an area. That's the body's natural way of healing. So if you're pounding down anti-inflammatories, don't expect stem cells to even help you. Okay? It may help a little bit, but it's not going to get a complete healing. Another reason is not enough treatment. How many times will it take? Patients always ask that. Will it be one time? I don't know. We don't know the answer to healing. We just know that if you do enough of it on an area that we choose that we think can heal, you typically will heal. Other failures are from not using an ultrasound. And most doctors do not use ultrasounds to guide their needle. And then a final thing is what we call a bad doc. It's somebody who really doesn't know what they're doing. They've gone to a weekend seminar, or people go out of the country to get these things done. They're getting IV stem cells that basically do mainly nothing at all, in my experience. People feel good for a few days. It's a good anti-inflammatory, and they have a halo effect because some actor went down to Panama or something, and it worked for them supposedly. But, my experience is we get people who have gone all over the world. They've spent 20, 30, 40 grand, believe it or not.
I just had a patient yesterday, Doc, that was getting quoted $40,000 for a single knee injection. And they didn't do it because they listened to our show and they asked the question, do you use ultrasound? And they said no. And they said, yeah, I'm running out of here. I'm like, I'm not going to go do that.
I mean, it's total ripoff.
Yeah, man. It's
ripoff.
That's an unfortunate situation.
And then this whole thing about I'm getting IV stem cells. In my experience, that's a ripoff. Now, years and years and years and years ago, before people knew about stem cells, I did go out of the country and have IV stem cells done twice. I'm just fessing up. It did nothing for me. Zero. So I'm not a believer in it yet. There may be a time when there are stem cells that have a certain line that's been produced where it is going to work. And I just spoke a couple weeks ago with what I consider to be, hang with us, folks. We'll get more into stem cells and platelets, how to heal your body. We'll talk to Dr. Thomas Grove, who's an expert in this field, and myself, Dr. Marc Darrow. Give us a call at the studio. Talk to us live. 866-870-5752. Call the office, 800-300-9300. Talk to our staff. Get a consult with them for free.
You're listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Their practice is located at the Joint Rehab and Sports Medical Center in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow and Dr. Grove will be back in just a moment. Stay tuned.